The House is in the Committee of the Whole House of the State of the Union for consideration of Bill H.R. 4785, which the clerk will report by title.
A bill to amend the Public Health Service Act to establish a program of grants to provide preventive health service with respect to acquired immune deficiency syndrome and for other purposes.
Pursuant to the rule, the bill is considered as having been read for the first time. The gentleman from California, Mr. Waxman, will be recognized for 30 minutes. And the gentleman from Illinois, Mr. Madigan, will be recognized for 30 minutes. Chair recognizes gentleman from California, Mr. Waxman.
Mr. Chairman, I yield myself such time as I might consume.
Gentleman will suspend. The committee will come to order. Gentleman from California.
Mr. Chairman and my colleagues, some people speak about the AIDS epidemic as if the whole epidemic were over, as if it was a problem only in the 1980s. AIDS is not over. We have, in fact, seen only the beginning. Having missed our opportunity to provide an ounce of prevention, we now must prepare to pay for pounds and pounds of cure. There have been over 130,000 cases of AIDS reported in the United States among adults and children. The Centers for Disease Control estimate that there are 1 million Americans infected and that 20% of these people are very close to becoming sick. And we have no plan to deal with these health care needs. Hospitals and community care providers are overwhelmed. Voluntary organizations and charities are straining to the breaking point.
The House is not in order, Mr. Chairman.
Gentleman makes a point of order that the committee is not in order. Chair recognizes Mr. Waxman of California.
Surgeon General Koop, who testified before our subcommittee this year, indicated that in his opinion we have no plan for dealing with these problems, despite all of his efforts and all of ours. This bill today takes an important first step. The AIDS Prevention Act of 1990 is a bill to provide for health care services in response to the AIDS epidemic in the United States. It authorizes funds for services for prevention, both for preventing infection among the uninfected and preventing the disease among those who are already infected. It also authorizes funds for health and support services for people who are ill and for emergency assistance to those cities that are hardest hit by the epidemic. These measures are long overdue. Many of our public health clinics that are trying to control such problems as drug abuse or tuberculosis are being asked to provide AIDS services as well, with no additional funding. The results can only be an erosion of these clinics' primary services. Many of our AIDS counseling and testing programs have no financing for the provision of early intervention health care. The result can only be incomplete prevention programs that serve no one well. Many of our hospitals are struggling with a tidal wave of acute cases of AIDS coming into their emergency rooms and admitting offices and have no place to serve these people on an outpatient basis or after their hospitalization. The result can only be overcrowding and diminished level of care. Such inadequacies are in no one's interest. The system does not adequately prevent infection among the uninfected, prevent disease among the infected, or provide care for the sick. And the system concentrates its care at the most expensive point, acute care for persons who are desperately ill. This bill will take first steps to remedy these inadequacies. It will provide for a continuum of prevention services, counseling and testing, diagnostics for those who test positive, therapeutics for those whose diagnostics indicate a medical intervention. It will provide emergency relief for those cities that have been hardest hit by the epidemic, and it will provide ongoing demonstration projects for the provision of comprehensive care to those who are ill. This bill was reported unanimously from the Subcommittee on Health and Environment and from the Committee on Energy and Commerce. I anticipate no serious opposition to its passage. We will have some amendments, which I will discuss at the appropriate time, over which there is controversy. But when we get to the final passage of the bill, I expect that this bill will pass easily. I want to thank the members and the staff from both sides of the aisle for their help in moving this legislation so quickly and so smoothly. A number of difficult issues have been resolved, and I think these efforts will be rewarded with a bill that all members can vote for and be proud of. I urge support for the bill and retain the balance of our time.